All right. Well, I am here with Alex Papale, and I am excited to kind of hear a little more about you and your practice. If you want to start by saying where you are and the kind of clients you see and the kind of work you do in the world, that would be awesome.
Yeah. I am in Boston, Massachusetts, and I am a pelvic floor and orthopedic physical therapist. Um, I I've been doing PT for 2 years. I've been in Boston for 8. So like that's just like been my home base at this point. Um, Predominantly working with also based on like preference kind of and just like happenstance of like working with like largely like younger folks, which is really cool, like a lot of like college age people, lots of queer and trans folks, which is like also really exciting 'cause that's like my favorite group of people to work with. I guess if I had to like choose working, I work with everybody, but generally that's the case.
You can have a preference.
Yeah, I was like, I'm not like discriminatory of like obviously like who I work with, like I'll see anybody, but also it's like really exciting when like I'm like, oh, like queer trans folks like coming in. Love working specifically with like also like kink folks, like love that. Because I'm also a sex educator. I worked at a local sex shop for 2 years, teaching workshops, and I still I've like taught workshops just like outside of there, just like on like pretty much anything from like safer sex to kink specific things, like technique kind of stuff to like just like sex across like any age, like sex for like older folks or like pregnant folks or like pretty much anything. Like love talking about it. So like those things really overlap a lot, and I find that I'm not sure if it's like because of those things, but also like a lot of my patient demographics or like the people that I treat the most tend to be like pain with sex or pain with like pelvic pain largely.
Right on. Yeah, it's so good to know who you can be honest with, like which providers you can be like, this is me, this is my life, and also I need a pelvic floor physical therapy. Now what?
Yeah, it's
Uh,
huge.
yeah, so awesome. So glad we get to live in the same place. What are you querying right now?
Ugh, like I mean, what are you not? I guess like existing as a queer person these days, like hopefully everything. But yeah, I think like just healthcare, I would like to say. Also sex ed always. But yeah, I think like largely making it known that queer, inclusive, and like not even like inclusive, like queer, like competent healthcare is a necessity and absolutely like should already exist. And I love what I'm doing, but I kind of wish like what I was doing specifically was just like not really a thing because it should just be like normal or like expected, which is unfortunately not the case. But and like same kind of thing with sex ed, like a lot of the things that I talk about, I do a fair amount of sex ed for providers, which is also really fun and like something that I like wish I wasn't doing because it should just be included, but making sure that that is always through a queer lens, because that is such like a big lack in like any sex ed. If anybody gets any sex ed, it's usually like very like heteronormative and cis normative. So that's like I guess those are my big ones, I think.
That's awesome. I mean, we need it. I'm all for it. That's great. And I'm curious to hear a little more about what got you started in the first place. Like, how does one decide to become a sex educator, pelvic floor specialist?
Oh, great questions. I decided to do pelvic PT. I think, well, I like was in PT school and like not like loving pretty much like anything else. I was like, oh, ortho's cool, or like I don't know, like I haven't really found anything that I like love. And then like I have like a distinct memory of like working in like a group like during PT school, and I was like would always like it was like a research group of some sort, and I'd always like be like, and this is how like this thing affects like these marginalized groups, or like this is how this affects like trans people or like whatever it is, or like LGBTQ people. And someone in the group like made a comment that was just like, well, we all know what like Alex is gonna do, like with like their degree, and I was like, what? And then I was like, oh my God, like, okay, yes. And then also like the pelvic side of that was kind of came in with, so that's like the advocacy, I guess, like part of it. And then like the pelvic side of it came in because I have like chronic pelvic floor dysfunction, and I have had it for like since like my teens really. And I just never knew that that's what was happening. And it was literally me in like PT school on a pelvic floor clinical rotation before I realized that like it's pelvic floor stuff and not like the chronic UTIs that I thought was what was happening, or like was telling myself, or things like that. And I was like, okay, if it took like me being in PT school, like in a pelvic rotation to get the healthcare that I needed, and like how is anybody else supposed to access this, and like how are like queer and trans people supposed to be able to access this particularly, like are you kidding? And so as that like became like a big point of that. And then I was I was teaching a course for healthcare providers about like trans inclusive healthcare, and the sex shop that I used to work at ended up tabling at it. And I just like started talking to them. I was like, oh my God, like also sex ed is like something I love to talk about, but I like just don't have like as much experience with it. And they were like, well, we're like hiring. And so then I picked that up and just like deeply fell in love with it. And yeah, like it was really cool to get like a semi formal, it's not really formal, but like a very comprehensive like sex ed training at this job, like along with, and then like just like having the experience of like teaching workshops and like learning a lot and having all these resources available.
And that's awesome. I mean, I love a good, personal draw story, right? Like that's really when you can, I think, make the most impact with other people when you personally are going through something they are, or that's
Yeah.
how they seek you out or find you as a provider. But it's kind of funny that you ended up in PT school, like not really thinking about it until like deep in the program. That's very interesting.
Yeah, I do think it's really wild that like literally someone else had to be like, well, we know what you're doing. And I was like, what am I doing? Like, tell me, please.
This is just how I live my life. I don't know.
Yeah, I was like, I don't know. This is like what I get mad about. And then they're like, yeah, obviously you can get paid to get mad about it.
Yeah, that's awesome. Yeah, that's right. Yeah, get paid. I love it. Well, you kind of have touched on this, like in terms of knowing about comprehensive sex education and being queer and trans, not just inclusive or competent, but focused and, in it yourself. Do you have a specific support philosophy that you bring to your work with clients?
um, yeah, I think that would just look like meeting people really where they're at. And I think that especially for queer and trans folks, especially with pelvic floor dysfunction, there's just so much shame that comes with that, which is super relatable. And a lot of that can be like, there's just like so many facets of experiences and identities that can bring that up, whether it's trauma, whether it's like internalized homophobia or transphobia, or it's like having a hard time like being able to like say out loud that you have like this sort of like dysfunction that largely affects your sex life or your ability to like experience pleasure, which is already really hard to talk about. That it's a lot of it is just like hearing people and validating their experiences and just like meeting people like really where they're at, and like whatever their goals are, like working towards that and just like validating them, and like not doing my best to like also like not put like my goals on somebody of like, oh, like if this is like they really just want to be able to do like this thing, then like I'm gonna try to like that's gonna be like our functional goal, and not like this like the kind of like insurance push like, oh, they need to be able to like insert a speculum or like whatever it is, like which like you might have to do like for insurance purposes. But like
Mm.
it's really important, I think, to me to like any of the like little nuanced things that are really important to like my patients, or things that I like really try to center.
Yeah, interesting. Did you say that being able to use a speculum is required by insurance? What was that? I
Oh
missed
yeah,
that.
that like insurance, oh my God, yeah, so insurance will not cover like pain with sex for folks that don't have penises. And that's just like generally true. So we tend to have to bill insurance with like my favorite code that I use is just like other muscle spasm or like general pelvic pain, but it has to be like, oh, like functional goals if insurance requires those, or like, oh, like patient will be able to like insert a speculum.
Wow. Yeah, that's fascinating to think about that side of it. I
Yeah,
it's
it
so
is
messed
like
up.
kind of wild to be, yeah, exactly, to be like, that's obviously like not most patients' goals. Like maybe it is for some people, but like that's not like why they're coming to PT. But like that's usually like how things like have to get
Right.
wrote about or like billed, unfortunately.
Yeah, wow. Thanks for sharing that.
Yeah.
Fascinating. All right. Well, you told us a little bit about your pelvic floor work, your sex education work. Now I want to know about your natal chart. What's your
It,
sun, moon, and rising?
it's like, I mean, yeah, it's a trip. Okay, so I am a Virgo sun and an Aries moon and Aries rising. Like, yikes. But
These Aries. All right. All right.
yeah. And also like starting to learn about like houses. My Aries rising is in my first house, I think. So like that's also just like even more Aries, and yeah, can be kind of intense. And I think like other aspects of my chart that kind of like make that a little bit more palatable is, well, maybe not, this is arguable, but like that my Venus is in Scorpio and my Mars is in Cancer, which I think is like very like the Virgo and the Cancer are very like the caretaker vibes. And then like I feel like fiercely like protective of like my patients and like my work and like the communities that I work with. And I think that's like the Scorpio, Aries, and Virgo, honestly, and like also Cancer. But like, yeah, I think like my chart is like honestly very accurate for myself and also like a little bit much, but
It's cute. We can be, true to ourselves and still be a little bit much, but it's
yeah,
really sweet to hear the interpretation of how it comes into your work, even.
yeah, it's fun. A lot of just like, yeah, I feel like the Virgo and the Aries to me is just very, a lot of like a high quantity of like somewhat finished to-do lists. But it works out.
I think a lot of people can probably relate to that. That's
Yeah.
awesome. All right. Well, I'd love to know what if you have a favorite thing about being a queer sex educator and pelvic health professional and working with queer and trans people. I mean, you've touched on a little bit, but if you have a specific thing.
I think my favorite things are like the sense of like relief from patients that I get sometimes, of just like, oh, like you get it, or like, oh, like it feels so nice. And whether or not like this has been like verbalized, or just like you can get like the sense of it, of just like the comfort that comes with that. And I think also just like getting to know like patients in general, like building a relationship with them, of just like feeling like they're like, oh, okay, like I can actually like I can talk about these things, or I can like bring up like these like nuances of like my sex life or like my kink life, or like if there's like even just like little things of like when folks like mention that they have like maybe they have multiple partners, and like that's something that you don't like necessarily get to share with a healthcare provider, but it can be like really important. And it just like feels nice when patients feel comfortable enough to start to like say those things. And for then like, yeah, for like to earn that like level of trust and comfort is really huge for me. And I think it's also like for anybody, but also particularly for like queer and trans folks, to like trust a healthcare provider. It's an honor, and it's also like heavy because you're like, oh, this is I'm frequently told that I'm like one of the few for folks oftentimes, which like is horrible and also is like relatable. So I think it's like,
Definitely.
honestly one of the things that I like really, really like love a lot, especially with just like how much time I get to spend with my patients.
Yeah, that's awesome. Yeah, especially doing pelvic floor PT, right? It's not like 5 minute in and out kind of work.
Right.
Yeah, thanks for sharing that. That's really sweet. So, in terms of pregnancy care, I know you mentioned that you would see pregnant clients and thinking about sex ed and pregnancy too. Is there something that you would hope to improve about the experience of perinatal period, postpartum pregnancy, whatever, for queer and trans patients?
Oh my God. Yes. Yeah, absolutely. But I think something in particular would be like just make like that, like the hope that like pelvic PT in general can be affirming and accessible for pregnant folks or their families, like in any span of like the pregnancy timeline of like pre-pregnancy, like during pregnancy, post-pregnancy, like any of those times I think are really can be really valuable to like have access to a pelvic PT, even if it's just like for like one session of being able to come in and like learn a little bit more about your body or like learn about your pelvic floor in general or like get a sense of what your pelvic floor is doing like before you get pregnant or like right in the beginning or like whatever it looks like, and then to be able to like have that baseline for when someone is going through a pregnancy, if like things come up, if like low back pain starts up, or if like there's like pelvic floor pain or like pretty much anything, or like questions about how to have sex, like all of those kinds of things. I would love for that to just like be more available. And I think a lot of folks that I work with, especially pregnant folks or postpartum folks, are things like, oh, like I wish I like knew about you like a year ago or like 5 years ago, or like that this was even an option, or like that I could have told my friends and or like my like whoever. And yeah, I just like always am like, I wish this was more accessible. I wish people like were told by other providers that like we exist and that like your care could be like, yeah, that they're like we could also like be in your corner for your care, like especially during this like really life-changing time.
Yeah, absolutely. I totally understand that, having wanting to have that earlier touch point, like
Yeah.
before things have to get really bad, for
Mhm.
people, ideally. But yeah, that's a great thing to work toward. Do you have a nugget of advice for any aspiring queer and trans pelvic floor PTs and sex educators out there?
Ooh, I think my advice would be, at least for like, okay, so like for like the healthcare side of it. I mean, I guess like everything can be kind of like a little bit universal, but for like the pelvic PT side of it, if you are ever find like a PT that does the things that you want to do or has an approach that you want to like kind of create, like make your own, like in your own way or like whatever it is, or like basically like reach out to them. I think that sometimes, especially on like being a student or being like an aspiring PT, it can be really intimidating to see like the people who have kind of like are doing it, or like the PTs, and like feel like there's this huge gap, which is like because of our education system and our healthcare system of creating this like hierarchy, and that like we're somehow like inaccessible. But I think especially for like queer and trans folks, if you find someone who's like doing what you want to do, like please reach out to them, like myself included. If any of this like resonates, like I love to talk to people who are like thinking about or interested in it. And like I can't speak for everybody, but like generally I think we've all been students and like felt like no one is doing what we're doing, especially queer and trans providers. So like I don't want to be like one of the few. I want to be like one of the many, and like trying to like get other people there. I think so. I think it's just like if you find anybody that like that resonates like with, then like please like reach out to them. And then I think in like the sex ed aspect of things, I think something that's like really helpful for me is that you're never gonna know. You just will know. And same thing with PT. It's like you'll never know everything at all, and you're gonna know some things, and then once you get like, comfortable with what you know, like push it more. And there will always be people who like know something different than you and know something more than you, or like have seen different things or experienced different things. And especially in sex ed, like just because someone has a degree doesn't make them more knowledgeable than people. Like it's just, I think also because the sex ed world is so like kind of like like anyone can call themselves a sex educator, and just like really be careful of that, just be aware of that. And not to say that like people who like call themselves a sex educator like and don't have like credentials, which is also like an issue. But like if like that fact that like people think that they need credentials about sex. But anyways, like just being aware of like where you're getting information from or like what you're reading, like making sure you're getting like the viewpoints of marginalized folks, especially in sex ed, because it's like sex ed is already like hard to access and like for like like everybody, and then like on top of that like just make sure you're not like getting all your information from like a cishet white man, please, which is hard to do sometimes in sex ed, which is like frustrating, but like find like the educators who are not any of those things.
Aw, I love that. That's great advice. And I think, yeah, we're big on, this keeps coming up with all the folks we're chatting with that, there's many pathways to doing this work. You don't have to have like all of the exact credentials all of the time if you are
Mhm.
in these communities. So
Yeah,
yes,
do
yes.
not, and like especially for like queer and trans folks, like do not gaslight yourself about like what you know and like your experiences and like your value in either world of like healthcare, of PT, of sex ed. Like
Mhm.
just don't like try. It's hard and I do it all the time, but just like try not to. Which is like impossible, but like worth saying.
Yeah, totally worth saying. And that's real. Let's be real. Awesome. Well, are there any projects you have going on or things you want to drop seeds, spread pollen on that we can put out there for you?
Um, I think right now I'm working on, since I just like I have like a lot more like time available, that I'm like working on really just like getting like my like trying to not um like gaslight myself and like my worth, and just like working on like my website and things like that, and just like having a platform kind of. But I'm always looking for people to collaborate on like any realm of workshop. I love teaching. So like any realm of workshop that like of anything that I've said or like anything that might be like of value or like of interest, like I love to do it. Always like love collaborating very much. And so if anybody's like trying to do that, um yeah, or just like creating like networks, like I really just like love, I have like a running list of like anybody who like reaches out is like, hey, like I like am like queer or trans or like kink friendly or like XYZ, and like I like resonate with what you're doing, like, and like I want to like have like referrals for people. So like if any, I'm always working on that, and if anybody like wants to just like let me know who you are, like please do that.
That's awesome. Yeah, more
Yeah,
overlap in any of those ways is
yes,
welcome.
please, like please reach out, love it.
Beautiful. Well, is there anything not sex ed related or not pelvic floor related about your life that you want to share?
Ooh, what about my life that I want to share? I'm sitting in my room right now and I'm looking at like the amount of plants that I have. Like I'm like one of those queers. Like the I am a plant queer. So that's like a fun, like as you can, oh yeah, you can see like my
Plant
palm.
parent. Yeah. Awesome.
Yeah. And also a snake parent as of,
Ooh.
well, as of this like quarantine.
Oh, fun. New
So
quarantine snake.
yeah, I have a 4 foot quarantine snake named Honey.
Oh my God, that's amazing. What kind of snake?
She's a corn snake, love of my life. Like
So cool.
truly, it's like yeah, it's great. Yeah, like I call her my primary partner. Just like
That's so sweet.
yeah, just like like truly like I'm like, oh, is this what this feels like to like love a
Other
being like
human.
more than your more than yourself? It's like,
Ah, that's hilarious. I'm so glad you said that.
yeah, so like I guess those are like fun things to like know. I feel like you can't like have a conversation with me and not be like, and my snake. Like,
Well, I get it. I get it now. That's amazing. So yeah, beautiful. Well, where can people connect with you if someone is like an aspiring trans PT or looking for pelvic floor stuff in the Boston area or even telehealth? Like, where do people find you?
um, yeah, I have a not super active Instagram page, but it does exist and I am on it. I like check it, but I'm like not great at like telling myself I can take up space on social media. unpack that at another point. But it's the Sex Positive PT, which is an Instagram handle if you're just trying to like keep up with general things. And then I have like I don't have a website. I almost said that, but like Flourish Physical Therapy is where I work, so I am on Google there, and um, I have like email address if like that's helpful. If I like, I can like I can like send that to you or like
I can plug that in. Yeah,
okay,
we could do
great.
email.
Yeah, and like please like anyone literally feel free to just like email me at any time. I do check it somewhat regularly, so like please like feel free to. I'm not like the quickest email replier, but like I will eventually, and yeah, but
Thank you so much, Alex, for hanging out today and talking about yourself. I really enjoyed it thoroughly. So
yeah. Thanks for the invite. Thank you for having me.
no problem. Take care.